If you never check capillary refill and then you wait for a complication, it's always going to be harder for you to assess.
While we're injecting the tip of the nose, what can we do to reduce this risk?
Well, as with all complications, there's a whole system around it that you need to think about. So the first is having an educated patient. So you need to explain to them the risk while not also scaring them. So a little bit of redness is normal, but if it persists, then you should probably get in touch. If you have pain, you should definitely get in touch. Now, that's just your informational piece, but the next thing is assessing your patient well. So I suggest you get in the habit of feeling people's noses before you inject them. You should always sense, is this tissue strongly adhered? On this, you'll notice if you ever try and inject someone who's had 3 surgical rhinoplasties, their skin becomes adhered to the surface. There is no room to inject. I just simply wouldn't inject them. But basically, feeling first. And this is one of, as I've said already, it's one of those analog skills. It's very hard to give tight guidelines around, but you're assessing the sense that there's movement and space. And I know from feeling my own nose, it doesn't feel like there's a lot of movement or space here. I wouldn't feel confident with trying to change the shape of my nose so much. But other people's noses, you can sense that the tissue moves easily. The nose is mobile when you feel it underneath. If you want to see if you can lift the tip, try and do it with your fingers gently first, from the side first, before you try and do it with filler. Because all of that will give you a rough idea of how easy or how difficult this is going to be, which will hopefully make you stop injecting before you've put too much in, or you may not even do the procedure. In fact, that's the best case scenario, is that you assess the nose ability to move with your hands before you start injecting, because otherwise you're just trying to do it all with filler, increasing the pressure too much and then causing this problem. Now, I also think that capillary refill will probably be delayed in the early stages until compensation starts. So I say this to all the people we've ever trained, which is assess your capillary refill as you're going through the process. I check capillary refill when I'm doing noses probably 50 times. Each time you inject, you're checking it. And the benefit of that is not necessarily anything other initially, then you just get very good at knowing what normal looks like, and then if it changes, you'll pick it up. You'll have much more sensitivity. If you never check capillary refill and then you wait for a complication, it's always going to be harder for you to assess. You won't have the certainty. I know with certainty when something is delayed from what it was before, and that gives me the ability to act rather than just seek support from other people to make the decision for me.